Hip arthritis is a very common condition for older adults. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And my purpose and passion is helping adults regain their activities and day to day activities that they enjoy and improve their functional activity from the comfort of their own home. So, today I'd like to talk a little bit about hip arthritis and again how it impacts individuals, the signs and symptoms of it, and some treatment options from a physiotherapy perspective. So essentially what hip arthritis is, it's just the natural kind of wear and tear that takes place in the cartilage in through the hip area. So over time, on between our femur and acetabulum, which is part of our pelvis, the femur is obviously the big thigh bone there. What can happen over time is the cartilage that is between these two areas can start to wear down. And eventually, what takes place is we get this sort of bone on bone between the two areas. And then, as a result of this bone on bone, people will have inflammation in that area. They'll present with lots of stiffness and restrictions in terms of mobility in through the hip area, particularly first thing in the morning or with weather changes in some cases. Individuals will complain about lots of stiffness, lots of pain. Those first few steps, first thing in the morning, can be quite painful. And then also, the typical activities that will provoke pain will be impact type activities. So, walking on harder surfaces, uh, and again, things that would involve more impact, running, jogging, jumping, harder surfaces, as I said, potentially going up and down stairs. And in a lot of cases, patients will complain about pain getting up from a lower chair or when they're in more of a flexed, compressed type position. So typically, one of the positions that really provokes pain is when the individual has their leg up in that flexed position and inward. So kind of internal rotation with flexion will typically provoke pain for individuals. Uh, and again, this can be something that just comes on over time. The individual might have been doing specific activities that, again, put a large degree of stress or impact in through that hip area. And so, again, these are how patients will typically present. And then from a physiotherapy standpoint, a lot of times what we'll see as well will be, again, gait pattern abnormalities or limping. And so as a result of that, you'll also see weaknesses in certain muscles. And so, again, from a physio standpoint, we'd want to address some of these weaknesses. So, in a lot of cases, the glute or buttock muscles will be weak, again, as a result of perhaps not putting as much weight through that area, and so again not activating the muscle quite as much. You might also see some weaknesses in through kind of the pelvic area, pelvic floor, abdominal area, and then some of the surrounding muscles on that side in terms of the leg, so hamstring, quadricep weaknesses. And again, as I mentioned before, limitations in terms of range of motion. And so hands-on treatment to some degree may be indicated for the patient. Traction, offloading the hip, right, in order to increase or excuse me, to decrease tone in the muscles that surround the hip joint to help kind of lubricate the joint in terms of, again, adding in some form of traction. And then offloading exercises can really be helpful for the hip. So that might look like uh, using a stationary bike. That might look like doing some aquafoot pool type exercises. The buoyancy of the water, again, creates less impact through the hip joint area. And then what I found in a lot of cases is that, as I mentioned before, typically hip flexion, again, bringing that leg up and inwards, tends to provoke. And in a lot of cases, biasing the opposite position, which is more of a repeated extension type of movement, can, for some patients, help in terms of almost increasing the space in through the hip area, offloading the hip in some way, and again, biasing the opposite position of what's provoking in a lot of cases can give relief as well. And so, as I mentioned, there's several different kind of interventions that can be helpful for an arthritic hip. Uh, Again, strengthening through the area, mobility work, hands-on treatment, modalities such as heat can also be helpful. So there's several different interventions that can be done from a physiotherapy perspective. And then finally, trying to work on from a functional perspective, kind of mimicking some of the activities that the patient might be struggling with to regain function as much as possible for the patient. If you have any questions, concerns, feel free to leave a comment below. And if you're an individual who, again, might be struggling with hip arthritis yourself and is looking to, again, regain that strength, mobility, and function in the comfort of your own home, feel free to reach out. I will leave a link below for my contact information. And please check with a physiotherapist to make sure that this or any other information is appropriate for you. Thanks again for watching and have a great day. Take care.